Welcome to Angel Health Academy. Topic for the day or topic for the session is importance of budgeting in nursing management. Importance of budgeting. Budgeting refers to the process of creating a plan to manage and allocate financial resources over a specific period of time. So the term budgeting, it means to a process, a series of steps of creating a plan. In this, we are making a plan for managing, for controlling, and for providing financial, money related, monetary resources. That is money, material resources over a specific period of time, usually for 1 year. So budgeting refers to the process of making a plan, an advanced plan to manage, to control, and to allocate, to provide financial resources over a specific period of time. It involves estimating the income. In this process, first we will identify what is the actual income. Then second one is forecasting the expenses. So we foresee that what are the expenditure will come. Then we set the financial goals. So based on the expenditure and based on the income, we set the financial goals, and objectives, and we'll follow that, to ensure that spending aligns with the available funds. So we spend the money according to our income, that is according to or with the available funds. What is the money have in hand? Based on that, we'll make a plan and we'll make a goals and we will spend smoothly without occurring any liabilities. Now let us talk about budget in nursing. Budget in nursing management plays a crucial role, an important role, in maintaining the financial health of healthcare facilities. So maintaining the financial health, financial health means running every functions of healthcare facilities or having all healthcare facilities without any difficulty, with available budget, with available money or available capital. So it plays a crucial role in maintaining the financial health of the healthcare facilities or healthcare agency or healthcare settings, while ensuring the quality patient care. So our important aim, ultimate aim is to render the comprehensive and quality patient-centered care. For that we need all the facilities, that is man, money, material. When we achieve that without any difficulty and when we able to ensure or provide or render quality patient care, we need a sound financial health or financial support. Thus, budgeting is very important in nursing management. So, here is the 10 importance, the common or main importance about the budget in nursing management. One is for resource allocation, for providing needed resources, man, money, material to render the quality patient care. Then second one is staffing and workforce planning, planning for the adequate staff to render the quality nursing services. Then third one is cost control and efficiency. Cost control, controlling the expenditure, cost, and making efficient healthcare services. Then fourth one is quality patient care, rendering quality and standard patient care with available budget. Then fifth one is for performance evaluation of the each staff or healthcare setting or healthcare agency or hospital or health centers or clinics. Then for regulatory compliance. Regulatory compliance means nothing but following as per the rules and regulation or legislation of the regulatory body or governing body. Then seventh one is strategic planning and growth. So planning for the growth of the institution or organization or hospital or healthcare agency or healthcare facility, that is advanced planning to render the smooth, comprehensive quality patient care. For that also we need a budget. Then crisis management. Whenever an emergency comes, whenever an outbreak comes, we have to manage that. For that we need a budget for the crisis management. The ninth one is accountability. Last one is to maintain the staff morale, staff happiness, staff satisfaction, staff morale and retention. Retention means we have to retain, the staff for a long period, prolonged period in the healthcare settings, so they have to satisfy with the monetary benefits. For that also we need a adequate budget. So staff morale and retentions. Let us discuss in short brief about this important 10 points or importance of budget in nursing management or in healthcare setting. First one is resource allocation, allocating the resources or supplying the adequate resources to render comprehensive and quality patient care. In nursing, budget makes sure that essential resources, our essential resources in nursing are staffing, adequate number of staffing according to the staff patient ratio. Then medical supplies, to render the quality nursing services we need many medical supplies and equipments, and we need adequate medications. Okay, so the essential resources in nursing include staffing, medical supplies, equipment and medication. For all that we need a budget. Okay, thus in nursing, budgeting ensures that essential resources such as staffing, medical supplies, equipment and medications are available, okay, easily available or adequately available in hand to meet the patient care needs, to render the quality patient-centered nursing care. Thus, proper allocation of funds, proper allocation of the resources with the sound budget guarantees, make sure that departments, all the nursing departments functions efficiently, okay, or effectively, and have what they need to deliver the high quality care. Actually, our ultimate aim is to render the high quality comprehensive nursing care. For that we need a fund. With that fund we have to make a proper allocation of the essential resources. So budget in nursing is required to make sure or to ensure that high quality patient-centered care with the available essential resources. Second one is staffing and workforce planning. Labor costs are a significant part of healthcare budgets, and nursing is no exceptions. So in any organization, labor cost, that is the wages and salary of the employees, are very important. That is a major part of the budget. Major part of the expenditure will be or would be giving salary to the employees or other relevance or monetary benefits to the employees. Thus, labor costs are a significant part of healthcare budget. In nursing also, it is the major part or significant part or important part of our budget. Thus, budgeting helps nursing managers, nursing administrators to determine the appropriate number of staff required. So, based on the budget only, we select the adequate number of staffs. So, when we have sound or enough money, enough budget, that helps the nurse manager to recruit or determine or take decision about the appropriate number of staff which is required to meet the patient care demand. So based on the type of the patient, based on the number of patients, each ward need a particular number of or specific number of staff. That can be determined, understand, and that can be provided by the nursing manager with the help of the budget. Thus, budget helps the nursing manager to determine the appropriate number of staff required to meet the or to render the quality services based on the patient care demand or patient needs and problems. And it ensures that there are enough nurses in the ward, okay, in the hospital, to maintain safe staffing ratio, okay, the ratio between staff and patients, okay, 1:1, 1:3, 1:5, like that, okay, based on the INC norms, etc. Okay, maintain the safe staffing ratio without overspending the money, okay, without simply wasting the money, or understaffing, without having the adequate staff to render the patient care, which can affect patient outcomes. Okay, so adequate staff and inadequate staff or overstaffing or understaffing both will affect the outcome of the patient care services or outcome of the quality care services in healthcare institutions. The third importance is cost control and efficiency. Cost control, okay. With the rising healthcare cost, as you know that healthcare expenditure or cost for the healthcare services are day by day increasing, okay. With the rising healthcare cost, nursing managers must balance the cost control, okay. He has to maintain the balance with the income and the expenditure with maintaining ultimate aim, that is to render the quality and comprehensive care services. So he has to provide or make sure that patient is getting quality and comprehensive care. For that he has to balance the expenditure and income of the hospital. Okay, that says cost control with maintaining the quality care and quality services. Thus, budgeting helps to identify the areas where cost can be reduced, okay, such as minimizing the overtime of the staff. So, taking overtime by the different staff in the work setting or ward has to be minimized, okay, and optimizing the supply of use. That is prevent the wastage of the supply, okay. Optimizing means using what is required, okay. So optimizing the supply use or improving the workflow efficiency of the work of the staff, okay, or activities of the staff in the ward, that is workflow efficiency. So thus budget also helps to prevent the wastage of the money, okay, prevent the wastage of the money and materials and supplies, etc., and ensures and make sure that spending aligns, the expenditure will be aligned or balanced with the organization's financial capacity, okay. What is the financial capacity, what is available, okay, of the organization, what is the budget for that particular year. Based on that, it could be able to spend. That is called the spending alliance or spending balances with the hospital's financial capacity or hospital current budget. Then fourth importance is rendering quality patient care, okay, comprehensive and quality patient-centered nursing care. Effective budgeting ensures or makes sure that all the nursing units have adequate resources, so that is man, money and material, okay, that is staffing, supplies and equipments, medications, etc., which directly impact, okay, the patient care quality. So patient care quality or nursing care quality is based on the budget, of course, based on the available or adequate resources in the ward or in the hospital. Thus, effective plan of budgeting or utilization of the money ensures that nursing unit, nursing departments or wards have adequate resources which directly impact, which directly affect the patient care quality or which directly helps to render the comprehensive patient-centered care in the hospital or in the ward or nursing unit. Having the right staff, right number of staff, right equipment, adequate equipment and adequate supplies all ensures that or make sure that nurses can provide timely services to the patient, safe services, nursing care to the patient, and effective and efficient services to the or nursing care to the patient. All this improve the patient outcomes, okay, and patient satisfaction, okay. All this improve the patient's outcome. That means patient will get recover easily from the or early from the particular disease without complications, okay. Patient outcomes and patient satisfaction also, okay. Patient have more happiness and satisfaction in the healthcare settings or in the ward by getting timely services, safe services and effective patient-centered based on the patient needs and problems, patient-centered comprehensive services. That is about how budget is important in rendering quality patient care in the hospital or in the patient unit or ward. Then fifth one is performance evaluations, monitoring of the performance of the staff and performance of the ward and hospital, okay. Budget act as a performance measurement tool. So it is a tool, budget act as a tool in nursing management for the measurement of the or evaluation of the or monitoring the total performance of the employees or the staff, nurses and the ward, okay. Managers or nursing superintendents can track the actual spending, okay. What is the actual spending based on the budget? So when we make budget for a year, that may not be the actual spending, but with the budget or planning of the budget, it helps the manager to track, to identify the actual spending against the budget what it is already planned. If any flexibility, any changes occurs, that could identify the managers by comparing with the planned budget. At the same time, he can make a decision whether financial resources are being used effectively or not. So whatever the supplies, equipment necessary to render the patient care, whether it is used effectively or whether there is any wastage, etc., all can determine by the manager by tracking the actual spending against the planned budget or proposed budget. This allows for timely adjustment to avoid the overspending or resources shortage or wastages. So as the manager or nursing superintendent or nurse administrator can track the actual expenditure, okay, in the ward or in the unit or in the hospital, that allows for the timely adjustment. So based on that track, it can be adjusted. A manager can adjust that. That could avoid the overspending. Okay, thus it can avoid the overspending or wastage of the money, or at the same time, it can rectify the shortage of the resources and fulfill the adequate resources available to render the quality patient care. Okay, thus budget allows for timely adjustment of the expenditure or spending to avoid the overspending, at the same time to avoid the resource shortage. Then sixth one is regulatory compliance. Healthcare organizations, healthcare agencies, healthcare settings, including nursing departments, nursing wards, nursing units, must adhere, okay, follow the strict financial and operational regulations, rules, legislations, etc. or policy. Okay, so all healthcare organization has to be follow the financial policy of the institution. Then operational regulations or guidelines of the hospital, okay, or healthcare organization. Okay, budgeting helps to ensure the compliance with the financial policies. Of course, make sure the compliance, how to balance and how to follow, okay, with the financial policies of the hospital or institution or the ward, and compliance with the accreditation standards to maintain the standards of the patient care as per the accreditation body. I have already done a video to differentiate with the affiliation and accreditation. In that, I have explained clearly about the what is the accreditation, what is accreditation body, okay, what is their function, etc. So to maintain the standard and quality nursing care, there are accreditation body which make sure that the hospital is rendering quality patient care services, and even to follow the government regulation, government policies, government norms and rules and regulations. Then budget also ensures that the department operates functions within its financial limits, okay, based on the budget, based on the financial limits, while meeting the legal requirements. Of course, an institution has to face many legal requirements related to patient care, okay, related to welfare of the staff, etc. So that could meet by the hospital authority in relation to the financial limits of financial policies of the hospital. Thus, budget also ensure or make sure that the department operate functions within its financial limits. It may not go overspending. Okay, the expenditure may be balanced with the available budget based on the financial limit or boundary that set by the management regarding to the expenditure. Okay, while meeting even the legal requirements or legal issues. Okay. Then seventh one is strategic planning and growth. Nursing managers or nursing superintendent or nursing administrator use budgets to plan for the future growth of the hospital or the ward, okay, such as expanding the services, then purchasing new equipment and hiring for additional staff to maintain the staffing requirement of the particular ward or hospital. Okay, so nursing managers use budget, okay, with the help of the budget they make different short-term and long-term plan for the future growth of the hospital or healthcare agency or the department, such as expanding the services, they increase the services, patient healthcare services, then purchasing new equipment that is required for smooth patient care or sound patient care or to render the quality nursing care services, or hiring additional staff through recruitment, having new staffs, okay, getting new staff that is required to maintain the staff patient ratio and to render the adequate patient centered services. Thus, a well balanced budget, a well planned budget can enable or help the nursing leader to make long term decisions, to plan long term plans that align, that balance, that support with the healthcare facilities strategic goals. All the healthcare facility may have the long-term goals, so that is called the strategic goals, okay, for the profit making or to render the quality patient care services while maintaining the financial stability without making over expenditure or additional expenditure within the limit of the financial policy of the management. They make different long-term decisions and long-term strategic plans for the upliftment of the healthcare organization or for the growth of the particular organization. The eighth importance is crisis management. Of course, in the hospital or healthcare setting, in between there will be many crises or outbreaks. Okay, that has to be managed with the limited or planned budget. So budget play a critical role, an important role in preparing for healthcare crisis. Of course, institution or organization has to prepare in advance, okay, preparedness for any healthcare crisis, such as pandemics or natural disasters. For example, recently we had an attack of the COVID-19. Okay, that is a pandemic. All over the world, people are affected, or healthcare settings or healthcare agencies are affected to render the services for the victim of the or the patients of the COVID-19. Or we may also have various natural disasters where there may be a surge in patients, a number of patients, okay, because of the pandemic or because of the natural disasters, or the need for additional resources, that is staff, equipment, medications, all supplies to render the services in such situations. Thus, a flexible budget allows nursing management, okay, nursing manager or nursing administrator or nursing superintendent to adapt to the sudden changes. So, pandemic and natural disaster is a sudden change. Suddenly, a group of a number of patients get admitted in the hospital because of the pandemic or because of the natural disasters. In such cases, the nursing manager or the nursing superintendent has to adjust or adapt with the or solve with that problem with the available budget. Thus, the budget should be a flexible. Okay, a flexible budget allows nursing management to adapt to the sudden changes, ensuring that there are adequate funds available for the emergencies. Okay, adequate fund is available for any healthcare crisis. Okay, so whenever the budget has to be made, it has to be made as flexible. % of the total budget of that particular year has to be moved separate for the crisis management, for meeting the emergency situation in the healthcare agency as for preparing for the healthcare crisis. The 9th one is accountability. The nurse manager, nurse leader or nursing superintendent are held accountable, is responsible and accountable and answerable for their department's financial performance. So he should be vigilant. Okay, he has to supervise the staff who comes under as his subordinates. Okay, so nursing manager are held accountable, answerable and responsible for their departments, their own nursing departments, of the financial performance by monitoring and managing the budget. So continuous track or inspection or the managing, that is by managing budget, they can ensure that funds are spent appropriately, okay, according to policy and within the organization financial limit. Every organization maintain financial limit for the particular department as per the budget. This accountability, this responsibility also extend, okay, to ensuring that nursing team use the resources efficiently and responsibly. So all the staff, it is a responsibility of all the staff who works in any department to make sure that they use the resources efficiently and effectively without any wastage, and they should use the resources, all money material, as responsibly. It is their responsibility. Finally, the nursing manager or the ward in charge or the nursing superintendent are ultimately accountable for their department financial performance. That comes about accountability in relation to budget. Then last area, staff morale and staff retention. Budgeting affect the staffing levels. Of course, the welfare of the staff, the salary, everything is dependent upon the budget only. So budgeting affect the staff levels, equipment quality and the resources, other resources which directly impact the work environment. Smooth, healthy work environment is based on the budget. Okay, when resources are insufficient or inadequate, staff may experience a burnout. Okay, emotional burnout. Okay, disturbances due to overwork or lack of proper tools. Sometimes if there is shortage of staff, they get overwork, extra burden to do the additional work. Okay, so that also make emotional burnout of the staff. Or when there is lack of proper tools, lack of resources, lack of medicines, other equipments, during that period also staff may experience burnout. Okay, a well-managed budget helps maintain a positive work environment, a satisfactory work environment, okay, which may have adequate staff, adequate other resources, adequate equipment, adequate materials and supplies, which is essential to staff retention and staff morale. Morale is nothing but Staff satisfaction. Okay, so a well planned budget or well managed budget is very essential or very crucial for the staff retention. Staff retention means to maintain the staff in the particular ward or particular hospital or healthcare agency for a prolonged period. Okay, otherwise staff will have a turnover. They move to this institution to other institution because of the burnout, because of the overload of the work, because of the lack of adequate materials or proper tools. Okay, thus a well managed budget helps to maintain a positive working environment. Okay, satisfactory working environment, which is essential for the staff retention, to retain the staff in the ward and to maintain the morale of the staff. That is satisfactory working situation and working condition with financial support and other welfare support, of course, with adequate staff and adequate resources to render the quality patient care services. That is about the how budget is important to maintain the staff morale and staff retention. So far we have discussed about the importance of budget in nursing. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next and important academic video. Okay, an important thing is don't forget to convey your gratitude in the comment box. And once again, thank you for watching my video. See you and take care.